Please stand and join undergraduate students Jessica Lee Berkovich and Tira Holmes and Haley Vanderveit in the singing of American the Beautiful. The words are included in your program.
Oh, beautiful for spacious skies, for amber waves of grain, for purple mountains' majesty above the fruited plain. America, America, God shed his grace on thee, and crown thy good with brotherhood from sea to shining sea.
Thank you, and please have a seat. It is my pleasure, distinct pleasure, joyous pleasure, to welcome the families and friends of the 214 College of Nursing graduation class to this happy event. Chancellor Alan Mayers, Vice Provost Bottoms, Dean Colley, honored graduates, distinguished guests, faculty, staff, families, and friends. I am Dr. Terry Weaver and have the honor of being the Dean of the UIC College of Nursing. It is my sincere pleasure to welcome each of you to this most joyous occasion, which appropriately, our commencement is held on Nurses' Day during Nurses' Week. So we will celebrate the accomplishments of our graduate students, but welcome newly minted nurses into the fold of the profession. So it couldn't have been more better time than this. So allow me please to introduce our most distinguished guests. Dr. Paula Allen Mears is Chancellor of the University of Illinois at Chicago, and we are thrilled she's joining us. Dr. Karen J. Colley is Dean of the Graduate College. Dean Betty Bottoms is Vice Provost for Undergraduate Affairs and Dean of the Honors College. Barbara Safford, our 214 keynote speaker, and Dr. Kathleen Cohen Buckwalter is our 214 Distinguished Nurse Alumni. Now, just as a reminder, before we move forward, please take out your cell phones, follow me, silence your cell phones, and turn them off. We greatly appreciate it. Thank you very much. As the Dean of the College of Nursing, as I said, it is my distinct honor and privilege to officiate this wonderful celebration that marks the commencement or beginning of a new journey for each of you. This ceremony, which is the high point of your academic life, is dedicated to you and your accomplishments. I would like to extend heartfelt congratulations to all of you, and especially to your professors. Let's hear it. I would also like to take this opportunity to congratulate your parents, relatives, partners, children, and friends, and to thank them for their support, patience, and understanding while you were pursuing your dreams. Graduates, please join me in applauding these very special people, the ones who will help you get to this point in your lives. Amongst our graduates this afternoon are our award-winning students and recipients of prestigious scholarships. Would all of our students who have received an award or scholarship during your tenure at UIC please stand? Come on, stand. Come on. I know there are more of you out there. There you go. You are now among the elite nursing professionals representing the UIC College of Nursing. At the end of this ceremony, you, our students, will officially become our newest alumni, and I know that you will contribute to make significant contributions to our nursing profession with continuing to honor our tradition and values. This year, we graduate 28 doctors of philosophy, 15 doctors of nursing practice, 201 master's degree recipients, and 208 bachelor's of science degrees. I reach out to you now amidst all this excitement and energy to ask that you stay connected to the College of Nursing and to UIC and to become an active alumni. Don't be a stranger. Participate in alumni events. We have a wonderful Alumni Day in the spring. Join the Alumni Board of Directors and become engaged in alumni activities at all of our campuses. Whether you read the College of Nursing's magazine, Vital Signs, visit our website for our most recent updates, join us on Facebook, volunteer, or give back in your very own special way, just please stay engaged and involved with the College of Nursing and with the University of Illinois Alumni Association. Now, I had the privilege of attending special events at each of our campuses, and although most of the professors wind up teaching, I actually learned a few things along the way. First, I always know when our students have an exam. There is a number of baseball caps, the hair's pulled back, the hair's under the caps, it's not coiffed, it's, the contacts are replaced by glasses. So you always know when there is an exam because they're all just barely there and they're in their sweatpants. But I did learn that sweatpants, that actually now they're moving from sweatpants to scrubs, and that scrubs are the new sweatpants. But you all never cease to impress and teach me. And the other thing that I learned from all of you was that you do aspire to inspire. And we pride ourselves that we make leaders, that we produce the ones that are going to make changes. But it's so nice that you all recognize that and the importance of it. I'm amazed that you, the newest generation of nurses, advanced practitioners, and doctorates, will take your talent, knowledge, energy, and dedication to your patients and your peers every day, making a difference wherever in the world you may end up. As you pursue your specialties as a nurse scholar, a clinician, a clinical specialist, a clinical expert, or a nurse practitioner, we know that it is your dedicated passion and commitment to healthcare at the highest level that motivated you to pursue your degree. Your sacrifice of time from friends, partners, and perhaps your children in order to gain the knowledge and skills to advocate for patients and to raise the standard of healthcare overall, to evaluate the evidence and translate that into practice and generate the knowledge that will be used to change practice, cannot go unmeasured and is not lost on us. Healthcare delivery is in the midst of a metamorphosis. There is a new canvas in which you can make your mark, play a pivotal role as leaders in healthcare. Aspire to inspire. It is nurses who will be essential to bringing about the changes that are needed to ensure that all patients throughout the world have access to the highest quality of culturally sensitive care. With this new era in healthcare, there is new recognition that holistic, patient-centered care, the foundation that has always been nursing, will be the path to promoting health and reducing healthcare costs worldwide. Changing healthcare delivery for the better is indeed tackling a very big problem. And what is most exciting is that you, our nursing leaders, can be the risk takers tackling that bigger problem. You can do this by advocating for your patients, approaching things with your very unique perspective, not settling for the things the way they've always been done, and challenging the status quo. With this, you will achieve results and outcomes that will demonstrate the capacity and singular ability that is nursing. As the largest healthcare profession in the United States, you already have an extended legacy and a huge voice. Use it! Become engaged and bring about the necessary changes within our profession and the healthcare system at large. Stand-up comedian, the late former host of The Tonight Show, Johnny Carson, said, "Being in the right place at the right time won't make you a success unless you are ready." I think that all of you are ready. So the only question left to ask is, do you think that you are ready? Oh, that was a little, all right. Do you think you're ready? You're a very accomplished class. We are honored to have been part of your achievements, and all of us up here say congratulations. It is my pleasure now to introduce our distinguished guests, and Chancellor Paula Allen Mears in particular, who is a member of the Institute of Medicine, the Royal Society of Medicine, and a trustee of the New York Academy of Medicine. At the Institute of Medicine, she currently serves on the Members Award Committee. She also serves on the Chicago Civic Consulting Alliance, the American Council on Education's Commission on Inclusion, and the Executive Committee of the Coalition of Urban Serving Universities. In collaboration with the faculty, students, staff, deans, vice chancellors, and alumni, Chancellor Allen Mears established the UIC Global Certificate Program for undergraduate students, expanded research opportunities and programs for faculty, graduate and undergraduate students, created a Student Success Initiative and the Chancellor's Innovation Fund. New buildings and classrooms and laboratory renovations are underway as she changed the mantra of UIC from access to excellence to access to excellence and success. Now it gives me great pleasure to introduce Dr. Paula Allen Mears, Chancellor of the University of Illinois at Chicago.
Well, thank you, Dean. Thank you so much. On behalf of the UIC family, welcome everyone to Commencement 2014. I too want to congratulate our College of Nursing graduates and the many individuals who supported our students in every way during their time at this university. Congratulations, congratulations. I also want to welcome our keynote speaker, Barbara Seafried. She's visiting professor of health law at Lewis and Clark Law School. Welcome, welcome. We're looking forward to your remarks. I also want to acknowledge Dr. Kathleen Cohen Buckwalter, our 2014 Distinguished Nurse Alumni. There she is. Graduates, we gather today to honor your remarkable educational accomplishments and your unwavering desire to advance the multiple missions of this noble profession. You can take great pride in graduating from one of the top 10 nursing colleges in the country, and the college ranks second in the nation in terms of national funding from the National Institutes of Health. This is truly the #1 college of nursing in the country. Right? Come on. The faculty are stellar. They're on the cutting edge of their intellectual areas of interest. In other words, I'm saying to you this afternoon, you have been educated by the very best. Your hard work and devotion to this exceptional college have earned you the fulfillment and the joy of today's ceremony. Now let me digress just a bit. I was recently reading a report from the Institutes of Medicine and the RWJ Foundation. The title of this report was "The Future of Nursing, Leading Change, Advancing Health." This report calls for a major paradigm shift in the healthcare arena. The shift will demand that you create the evidence to undergird your practice. The shift demands that we will reinvent the provision of services, and the shift demands that we will create cost-effective care and quality care for our patients. What does this mean for you? Well, you've been educated by the very best. So this paradigm has shifted. You are graduating as this shift is occurring. So you will be a part and/or lead the transformation of the healthcare system, and you will be a part of the continuing transformation, evolution of nursing practices, research agendas, and the healthcare delivery system. Aren't you excited? Come on. Your dean just said you are leaders. You are change agents. By the way, the nursing science, the science undergirding the profession of nursing, will become much more dynamic, interdisciplinary in nature. What does this mean for you? Thus, the disciplinary backgrounds of your team in the clinics, in the hospital, as well as in the academy, will grow and become essentially dynamic and diverse. This is an exciting time. Back to today. Commencement is also a day of reflection, and I encourage you to turn your thoughts to memories of your time here, the faculty who mentored and challenged you, the staff you depended on, the students who became your friends. Take time today to treasure your experiences, the lectures, treasure, the lectures, the study groups, the research projects, the labs, the clinicals, and even the all-nighters. And I've only had chamomile tea, so I'm fine. Really, reflect on those all-nighters because they helped to create today. Appreciate today and always the colleagues, mentors, and cherished friends who sit beside you. As you join the proud ranks of over 11,000 distinguished nursing alumni, I urge you to stay connected to this college and to this campus and to each other. It is my hope that you will return to this college often to mentor the next generation and as a source of inspiration and renewal. I'll end with a quote. A nursing leader and innovator, Muriel Adelot, called nursing an art, a humanistic orientation, a feeling for the values of an individual, and an intuitive sense of ethics. As you begin your profession as nurses, as advanced practice clinicians, researchers, policymakers, and administrative leaders, and the list goes on, may you hold fast to the ideals of your profession and continue the honor of every individual. Best wishes and congratulations to each and every one of you.
Thank you, Chancellor Almaers. We are particularly proud and honored that Chancellor Almaers could be with us for our graduation since it is her last as she moves forward in her career and steps down in January as our Chancellor. At this time, I am just thrilled to introduce the keynote speaker, Barbara Safrit, Esquire. Professor Safrit's expertise in healthcare law has resulted in her current appointment as a visiting professor of law at Lewis and Clark Law School in Portland, Oregon. She previously served as Associate Dean for Academic Affairs, and she was a lecturer at Yale Law School from 1988 to 2007. In addition to those academic and administrative duties, She taught seminars on healthcare law and policy and the regulation, pay attention here, advanced practice nurses, the regulation of healthcare providers. While at Yale, she served in various roles contributing to health policy, including as a member of the Board of Advisors of the Yale Journal of Health Policy, Law and Ethics, the Board of the University of Health, and on the Executive Committee of the Center for Bioethics. Professor Seyfried earned a Bachelor of Arts degree in economics from Goucher College, a Juris Doctor degree with honors from the University of Maryland School of Law, and a Master of Laws degree from the Yale Law School. She has published and lectured extensively on topics of administrative and constitutional law. Since 1993, her teaching and advocacy work has focused on issues of healthcare professionals' licensure and regulation and healthcare workforce problems. Her work has garnered recognition and invitations to many national policy committees and boards, including the Pew Health Professions Commission, the U.S. Agency for Healthcare Policy and Research, the U.S. Public Health Service, the U.S. Department of Defense, the American Hospital Association, the American Nurses Association, the American College of Nurse Practitioners, and the National Council of State Boards of Nursing. Professor Seyfried was selected as the inaugural honorary fellow of the American Association of Nurse Practitioners, based on her many years of support and advocacy for nurse practitioners. Her esteemed career as an advocate of nurse practitioners started with her seminal paper in the Yale Law Journal in 1993 entitled Healthcare Dollars and Regulatory Sense: The Role of Advanced Practice Nursing. This publication began the current conversation on the value of advanced practice nursing from a quality and economic perspective. Her most recent work, published in the groundbreaking Institute of Medicine's report on the future of nursing, Leading Change and Advancing Health, was federal options for maximizing the value of advanced practice nurses in providing quality, cost-effective health care, help solidify the inclusion of nurse practitioners in the changing healthcare debate. Largely due to this important paper, nurse practitioners were given the recognition needed to become providers in the Affordable Care Act. At her induction as an honorary fellow of the American Association of Nurse Practitioners, Professor Seyfried was appropriately described as most deserving friend of nurse practitioners. She was also instrumental in the very latest report by the Federal Trade Commission that talked about restricting nursing, advanced practice nursing practice is a restriction of trade. And so please join me in welcoming a true advocate of our profession who will no doubt impact the career of every single graduate here today, Professor Barbara Seyfried.
Actually, I'd rather sit down and hear that all again. It was kind of nice. Thank you for that kind and very fulsome introduction. I am truly honored to have been asked to join you on this, I hope for you, memorable day. This day is all about you. And as we gather to celebrate your accomplishments, your academic endeavors, your discipline, your hard work, they all really are signaling your attainment of professional, clinical, and research skills. For some of you, I know this is the first step in your professional career. For others, it represents additional stages of your professional development. For all, however, I hope today provides an opportunity to take pride in your own achievements as nurses, first and foremost. When I was asked to speak at this graduation, initially I have to say I was rather hesitant, not because I'm anxious about public speaking. I was counting up on the plane flying here. I've probably given over 500 speeches in my life. Well, I started early. I don't think my family would call them speeches. I talked a lot, but about 500 speeches to national and state legislative and administrative agency bodies, to international and national and state professional associations and foundations and the like. And all of those, I'm not anxious. I view those as a piece of cake compared to speaking at graduation. So you might ask, why is that? Well, as a very wise woman told me a few years ago when I was preparing to give a graduation talk, I asked for her advice on what graduates would like to hear. And she told me the following, which I do think is the best summary of the perfect graduation speech and perhaps the shortest in the world. She said, what they want to hear is the following: welcome, you did good, keep doing good, goodbye. Recognizing, so now I can sit down. Recognizing that the carefully planned schedule may have allocated a bit, but only a bit more time for my comments in this, let me share some thoughts on the following. First, the topsy-turvy nature of the healthcare delivery and financing system that you will soon be immersed in, either for the first time or as continuing your careers. Secondly, the challenges and opportunities that you will have in utilizing your enhanced nursing competencies. And finally, my suggestions, which will be brief, for how you can maximize the value of your skills for the benefit of your patients and, yes, for the public in general. First, our healthcare delivery and financing system. It should be obvious to all that there's precious little accuracy in that phrase. Let me just point out one or two of the fallacies inherent in the notion that we have anything approaching a health care delivery and financing system. I think you're getting the point already. I don't have Tourette's syndrome going like this. Health care, for example. For most of the past 5 or 6 or more decades, our focus, both in service and in research funding, and yes, in education, and importantly, in payment or reimbursement, as you all in the health arena like to call it. We attorneys call it pay. You all talk about reimbursement. But for the past decades, our focus has been almost exclusively on curing illness and disease, not caring for the health of our people. That is, instead of prioritizing health promotion and prevention, trying to forestall or reduce the incidence of disease and illness, we wait until health fails and then pour all efforts, and very expensive efforts, into high-tech interventions to try to combat the illness. Just think about this for a moment. I'm sure that you all know of or have read about healthcare providers whose annual incomes are in the $1 million plus range. But do you know anyone who earned anything like that as a result of keeping people healthy? For example, by promoting good nutrition, or exercise, or drinking less or smoking less, or learning to read, or delaying pregnancy until after one's early teen years, or dealing with how to manage stress or aggression, either at home or at work. You probably know no one who, in promoting health, are the top earners in our healthcare delivery system. Now let me be clear. I support advanced scientific research into the origins and cures for disease. However, we have paid too little attention and given too little funding for what is increasingly clear, and that is that the majority of the determinants of our population's health status throughout life are tied to social, behavioral, and economic factors. We have begun to rebalance our focus on health and prevention and health promotion, as surely we should continue to focus on curing the inevitable illness. But we have much fine-tuning to do in this regard to get a better balance of emphasizing health as well as curing illness. Now, what about our delivery and financing system? I can hardly say those words without smirking, because we don't have anything that meets even the most general definition of a system. That would intuitively, never mind resource to your dictionary, reflect notions like being organized, or rational, or efficient, or coherent, and geared toward achieving identified goals. We don't have that. Rather, we have a hodgepodge of fiefdoms, silos, and bureaucracies, and a payment or reimbursement scheme, which to me often resembles nothing more than webs spun by rabid spiders who have perhaps overindulged on steroids and LSD. There is much I could say about this resulting mess, but we don't have time. But let me just note 2 or 3 examples. Look at treatment systems. We have primary care, or no care, primary care, specialty care, subspecialty care, inpatient, outpatient, ambulatory surgical centers. Even in the same facility, it typically is unconnected. The patient has the responsibility of connecting the dots. So I would not call that a treatment system. If we look at payment or reimbursement systems, it's even worse. We have had in this country traditionally fee-for-service, where you got paid for doing regardless of the quality of the result. And in fact, until recently, there was a perverse incentive. If you did it badly the first time, you got paid for doing it, and then you got paid for trying harder the second time and doing it right. In addition to paying for doing as opposed to thinking or consulting or observing or explaining or counseling, you get paid. Our whole payment system is skewed toward procedures. What you do, you get paid for. Your thinking, your critical analytical skills, and the rest, which are reflected in patient counseling, observing, all the rest, are vastly undervalued. All you need to do is take, for example, 2 scenarios. You're treating an 80-year-old woman who has diabetes and high blood pressure and has aphasia now from a recent stroke. She lives alone. She has no access to a car. She can't drive. And the closest grocery store or pharmacy is 20 blocks away. Your treatment of her, dealing with her physical manifestations of diabetes, blood pressure, and stroke recovery, are crucial. But also, so is her ability to read and understand what she needs to do and to be able to get nutritious food and, in fact, get to you for treatment. For your taking the time to explain all that, you will be paid nothing. Contrast that with a lens replacement for the most common procedure in this country, which is cataract cloudy lens like I'm getting. takes 6 minutes, mostly is computerized, and it will be paid 20, 30, 40 times what the full visit would be for the 80-year-old woman with lots of health conditions, which are challenging. So our whole payment system is skewed toward doing procedures, not the quality of outcomes that we have. And once again, they undervalue what nurses have been doing forever, which is observing, counseling, yes, treating, applying your vast clinical skills. But it's not surprising that it was nurses who figured out, in a vastly overfunded study, in my view, that if you put a blanket on a patient after the operation, you reduce mortality by about 8%. Or it was nurses in a $3.5 million study 2 decades ago to answer the question of why are almost 30% of all MRI procedures aborted midstream, meaning the patient jumps out of the tube and runs screaming from the room. Why does that happen? Well, nurses figured out that if you explain to the person before the procedure that this would resemble something like getting in a nuclear Cuisinart, people might anticipate what's happening and not jump and scream and run from the room. It's when I've had only one MRI. After all the paperwork and all the rest, as I'm going into the tube, they then say, "Oh, by the way, do you have any shrapnel in your body?" And I thought, what shrapnel? But no explanation, nothing. Well, it was nurses who solved those problems by doing what they do so well. Finally, let me note 1 or 2 payment issues and then move on to more positive things. Our payment system, there's not a person in this room, and I don't know how many there are here, but a lot. There's not one person in this room who has ever paid exactly 100% of the true cost of any of your care, because we don't know what the cost is. You've either paid too much or too little because others have paid through insurance. So first, we don't know what the true cost of care are. We know what charges are, but the charges they don't tell you till after the fact. And then when they do come, they're widely varying. It all depends on, are you insured? Because then you'll pay the full rack rate, uninsured full rack rate, or if you're insured, depending on the deal that your provider, be it institutional or individual, has arranged with the insurer. I talked to a manager of a CFO of a major hospital where I live the other day, and learned that they have 57 different charging codes for the same procedure of removing a gallbladder, depending on their prearranged negotiations with 57 different insurers. So when you think of rabid spiders on LSD spinning out a payment system, that's what we have. But perhaps enough of that what's wrong. Let me note that things are changing, and they're changing actually pretty quickly, but never quickly enough for me. But most importantly, they are changing, and that's where you come in. Because you have opportunities as nurses to join or continue in a profession that is long-standing, highly regarded, probably the highest regarded profession in the country. Your nursing profession is both traditional as well as ever evolving. You have clinical skills, critical thinking skills, technological savvy, and the ability to translate science into understanding and application, which is curing and caring. You also understand that curing requires caring. It requires support of all sorts. Now, things are changing. Our policymakers have finally discovered that coordinated care is a good thing. They've discovered that patient-centered care is a good thing, and that community-based care, as well as care in the home, is a good thing, and care is especially good when it's delivered by teams that coordinate with one another. And this is viewed as innovative thinking. I can say as a member of the public, not as a healthcare provider, I thought you were supposed to be doing that all along, working together to help me get better. Well, guess who's been doing this all along? It's nurses. From community and public health nurses to advanced practice nurses in the most specialized acute care units in the country, nurses have and do provide care across the broadest spectrum of our health and illness service. So you are well positioned, both by professional tradition and education, and I hope inclination, to play a leadership role in our ever-evolving healthcare delivery system. However, I would be remiss if I did not note especially a challenge that is in some ways particular to nursing that you will have to grapple with. Even though the roles and competencies of all healthcare providers have expanded, they have done so, and especially for nursing, in a practice and cultural environment steeped in hierarchy. I have experienced this hierarchy several times in the last year as my father has been in and out of hospitals, ICUs, rehab facilities, skilled nursing facilities, assisted living apartments, emergency rooms. And I cannot tell you how many times my father received poor care at the hands of physicians in emergency rooms, despite the advice given by the nurse in the emergency room, no, Dr. So-and-so, we shouldn't do that. We should do this. No, we're doing that. And that was done, and the next day we're back in the emergency room again. Hierarchy still plays a huge role in our system. Also, your continued expanding roles and competency take place against the legal backdrop, which I know a little bit about, in which medicine and the definition of medicine was universal and exclusive. That is, everything having to do with the diagnosis or treatment of human health or illness, physical or mental, real or imaginary, was defined as medicine, and all other healthcare providers, such as nurses, pharmacists, physical therapists, clinical psychologists, on, could act only under a physician's order, direction, supervision, delegation, or referral. This explains why, within my lifetime, it was illegal for a nurse to draw blood or start an IV without a physician's order, because in order to do either of those procedures, you must pierce the tissue of human beings, and that was included in the definition of medicine and excluded to all others unless ordered to do so by a physician. Now, as you know, and I hope you know from your health policy classes, things have changed. Several professions have succeeded in gaining legal recognition of their expanded skills and competencies and have that reflected in law. However, those who have enjoyed for decades the exclusive domain over all things medicine are actually, understandably perhaps, reluctant to share practice authority or to recognize that practice abilities necessarily overlap. And they are threatened especially by the progress that advanced practice nurses have made in almost 20 states in gaining legal recognition of their expanded roles and abilities to diagnose, treat, prescribe, order, refer, interpret, admit, all the verbs on their own license. To combat this growing role legally recognized for advanced practice nurses, supported by the National Governors Association, the Institute of Medicine, the Bipartisan Policy Committee, Pew Health Commission, I could go on and on. Organized medicine has seized on the teamness. Remember, this is a new innovation thing that we should practice as teams. The team and collaboration tropes, now the words du jour, and they have succeeded in passing a novel licensure scheme in one state which defines a patient care team as the following, and I always bring it with me because I want to quote correctly. A patient care team is a multidisciplinary team of healthcare providers actively functioning as a unit with the management and leadership of one or more patient care team physicians. The only person who can be a member, the leader of a patient care team in Virginia is a physician. Now, what this means is that no nurse practitioner in Virginia can practice as a nurse practitioner unless they are a member of a physician-led team. That is going backwards. That is reinstituting hierarchy and ignoring reality that skills overlap and you have your own professional competencies. Excuse me. This sort of measure is bad public policy, and it ties us to old ways, which we have made major progress in moving away from, because it ignores the notion that, yes, teams are good for care, but the leader of the team can vary. It should depend upon the needs of the patient through adaptive leadership. So this could be a nurse, a medical social worker, a clinical psychologist, an occupational therapist, a physician, whomever. So while we've made enormous progress, it has been made on the legal and regulatory front, much is left to do, because your ability, your authority to use your vast abilities depends on the law, on your scope of practice, on the reimbursement provisions for that. And progress has been made, but there's still a lot to do. So my suggestions for how you can maximize your value of the skills, which you have worked so hard to achieve, is to do two things. One is to continue to expand, refine, and apply your clinical skills and your research skills. But you also have to actively participate in policy and legal advocacy so that you and your colleagues may fully use the abilities you have worked so hard to achieve, both for the benefit of your patients and the public at large and your profession. I've always thought of nurses as the glue in health and illness care for decades. I urge you to cherish and honor that role, but I also urge you in the strongest sense possible to be informed leaders in shaping law and policy so we can move toward a truly rational healthcare delivery and financing system. Your profession depends on it, but most importantly to me, so do your patients. So I welcome you. You did good. Keep doing good. Goodbye.
There is a mandate I hope all of you take. Thank you so much. Sabina Dambrauskas is president of our College of Nursing Alumni Association and will welcome our soon-to-be alumni and present the Distinguished Nurse Alumna Award.
Thank you, Dean Weaver, and good afternoon. It indeed is my honor to present the Distinguished Nurse Alumna Award. This award, established in 1977, recognizes nursing alumni who have been involved in creative work, distinguished achievements, and service and important contributions to nursing. It is the highest award presented by the College of Nursing Alumni Association, and the 2014 Distinguished Nurse Alumna is Dr. Kathleen Cohen Buckwalter. Dr. Buckwalter's CV is amazing. She became an alumnus of the UIC College of Nursing when she completed her PhD in nursing science in 1980. Following the completion of her doctoral studies, Dr. Buckwalter returned to the University of Iowa, where she was the first faculty member to hold a PhD in nursing there. She went on to complete postdoctoral work and obtain a certificate in aging, which helped focus her research on the rural, older, and mentally ill populations within an interdisciplinary framework. She has developed and researched models for mental health services and delivery to older adults and care of individuals with Alzheimer's disease and related dementias. She has been awarded nearly $13 million in extramural grant funding, which is quite an achievement. And she was instrumental in obtaining funding to develop geriatric mental health training and the Gerontological Nursing Interventions Research Center at the University of Iowa. In addition, Dr. Buckwalter has presented at nearly 250 conferences and has served as an editor or on the editorial board or referee panel for nearly 20 journals. Her accomplishments have been recognized with more than 35 prestigious awards, including the Distinguished Contribution to Research Award from the Midwest Nursing Research Society, the American Psychiatric Association Excellence in Research Award, and as the first recipient of the National Gerontological Nursing Association Board of Directors Award. In 2010, Dr. Buckwalter was recognized as the Psychiatric Nurse of the Year by the American Psychiatric Nurses Association and received the Gerontological Society of America Doris Schwartz Gerontological Nursing Research Award, the most distinguished nursing award given by the nation's largest interdisciplinary organization devoted to the field of aging. Dr. Buckwalter's work has changed how we think about, treat, value, and care for older adults. It is my honor to thank her for her many contributions to the field of nursing and to present to her, on behalf of the College of Nursing Alumni Association, the 2014 Distinguished Alumna Award.
Goodness, Lord, this is lovely. Thank you so much for your kind words. Okay. Well, hello, everyone, and congratulations. I'm truly honored to be the 2014 recipient of the UIC College of Nursing's Distinguished Alumni Award. As you heard, I graduated with my PhD in nursing science in 1980 as part of only the second doctoral class. There were 10 people in my class, and at the time, 10 weeks in the quarter system. I commuted from Iowa City, Iowa via Greyhound bus for 4 years because I couldn't afford out-of-state tuition and an apartment in the Chicago area, and we had only one old rattletrap car that barely got my husband to work and certainly wouldn't have made the 500-mile round trip weekly. I would leave Iowa at 2 a.m. on a Sunday morning, and if all went well, which it usually did, arrive at the Loop, take the train to school, and be there in time for 8:30 classes, returning at 8 p.m. on Thursday night after 4 days of class. I relied on my classmates and advisor, Joan King, to provide housing, emotional, and intellectual support. Indeed, in many respects, I was the class project, staying with a different classmate every week. I remember when I interviewed for the doctoral program here at Illinois, one faculty person warned me that if I commuted to school, I would never be properly socialized within my class or the profession, and I would always be an outcast. As it turned out, I knew each and every one of them better than anyone else, having lived with them a good portion of 4 years, and those friendships and collegial relationships have remained strong some 3+ decades later. My first 2 children were born during my doctoral program at Illinois. Some would say that was my best achievement. And when classmates and former professors are asked to recall what they think about me, it's that I was perpetually pregnant. My daughter was only 6 months old when I finished my PhD, and she came with me to my dissertation defense. She had one of those big, noisy, smelly bowel movements that breastfed babies have during the defense, and the dean at the time, Helen Grace, who was a member of my dissertation committee, took her out and changed her diaper during the colloquium. So why did I go through all this? Because I wanted a quality nursing program and the best possible education, and that is what I received at UIC. I'm convinced that my later success as a researcher, educator, and administrator, and I served for 7 years as the Associate Provost for Health Sciences at the University of Iowa, were due in large part to the excellent preparation I received at the UIC College of Nursing. I have always believed in this quotation from Louis Pasteur: "Chance favors only the prepared mind." And I feel I got that preparation from the UIC College of Nursing. So I congratulate all of you graduates for completing this important step in your education and for your excellent choice of school. I remember the words of an early nursing leader named Adelaide Netting, who said, "Compassion may provide the motive, but knowledge is our only working power." And she said that in 1925. Dr. Lawrence Peters is credited with advising, "If you don't know where you're going, you will probably end up somewhere else." While I partially support this advice, I believe that a good nursing education prepares you for a variety of wonderful possibilities, many of which you may not even be able to envision today, as long as you develop excellence and follow your passion. This may require that you find a mentor, a master clinician, or a scholar in a research area that you are interested in. It also means that you should be open to collaborating beyond nursing boundaries, so broaden your field of vision, and be sure to keep your mind and heart open for opportunities, and be intensely curious to uncover the hidden. Collaborate with others and share your goals, and have the courage to change. Once again, congratulations from this proud alum.
Okay, thank you so much for those wonderful words. The next award presentation is the Student Recognition Award, and it is my pleasure to present the Nursing Alumni Association Student Recognition Award to 2 very deserving individuals. Mohammed Jamal Dean, a graduate from our Chicago campus, and Shannon Jeffrey, a master's program graduate with a concentration as adult gerontology primary care nurse practitioner from our Chicago campus. Congratulations to both Mohammed and Shannon.
My favorite star. Should have added basketball to think of it. Can't tell you how.
Thank you, thank you.
Thank you.
Thank you.
Thank you, Sabina. The Dean's Awards are given to outstanding doctoral graduates in both practice and research. The awards are based on evidence of superior performance, research and grant activity, fellowships, and scholarly publications and presentations. This year, we are pleased to present the Dean's Practice Award to Barbara Shaw and the Dean's Research Award to Cynthia LaFond. Congratulations. Wonderful achievement. Thank you. Candidates of the Doctor of Philosophy program, please stand. These nurse scientists will generate the knowledge and scientific evidence that will improve the health of individuals, families, and healthcare system in which care is provided. Chancellor Alan Mayers, upon the recommendation of the faculty and by vote of the Senate, I have the honor to present the candidates for the degree of Doctor of Philosophy.
Upon these recommendations and by the authority of the Board of Trustees, I confer upon each of you the degree for which you have been presented and admit you to all the rights and privileges and responsibilities of that degree. Do I stay here?
Dr. Linda Scott, Associate Dean of Academic Affairs, the Student's Research Advisor and the Student's Research Advisor will hood the student. Dr. Zerwick, Executive Associate Dean, will recite the names.
Kayla Banks, Moving Past Reality Shock, a model for new graduate nurse engagement, hooded by Catherine Vincent. Shri Yona, Perceived Partner Relationships and HIV Risk Behaviors Among Recovering Female Injecting Drug in Jakarta, hooded by Kathleen Knorr. Hinju Na, The Effects of Cyberbullying Victimization on Psychological Adjustments Among College Students, hooded by Carol Ferens. Maria Reyes, The Experiences of Women Diagnosed with Correctable Fetal Anomalies Participating in Perinatal I-Team Counseling, hooded by Patricia Hirschberger. Jessica Shore, Exploring the Lived Experience of Antiretroviral Treatment Among Pregnant Women, hooded by Susan Vonderheide. So-hyun Park, Family Influences and Healthy Weight for Korean American Preschool Children, hooded by Kathleen Knorr.
On behalf of the faculty, congratulations to our new Doctor of Philosophy graduates. Candidates of the Doctor of Nursing Practice program, please stand. The Doctor of Nursing Practice is designed to prepare nursing leaders as clinical experts in the discipline. Chancellor Alan Mayers, upon the recommendation of the faculty and by vote of the Senate, I have the honor to present the candidates for the degree of Doctor of Nursing Practice.
Upon these recommendations and by the authority of the Board of Trustees, I confer upon each of you the degree for which you have been presented and admit you to all the rights, privileges, and responsibilities of that degree. Better stay up here, right?
If you want to put that here, we have everything here. So,
Okay.
anyone
I've got some other.
Upon these recommendations, Dr. Julie Zurich, Executive Associate Dean and the Research Advisor, will hood the students, and Dr. Linda Scott will recite the names.
Barbara Shaw. Barbara will be hooded by Kathy Ryan. Her project was telephone triage workflow and the electronic medical record in federally qualified health centers. Okay. Mary Royce. Mary will be hooded by Kathleen Baldwin, and her project is titled Using the AD8 to Improve Documentation of Collateral History and Subjective Data. Okay. Jo Bung Jun Park O. Her advisor is Cheryl Sturgis, and her project is the analysis of hospital readmission patterns in Medicare fee-for-service and Medicare Advantage beneficiaries. Cheryl. Janet Founsler, who will also be hooded by Cheryl Sturgis, and her project is Influences of International Caring Practices on Patients' Perspective of Caring. Sheila Burke. She will be hooded by Gail Keenan, and her project is entitled Investigation of the Impact of an Appreciative Inquiry Experience on Faculty Engagement. Mary Teresa Johnson. She will be hooded by Kathleen Baldwin, and her project is Implementation of Interdisciplinary Evidence-Based Practice Cervical Cancer Screening Guidelines. Ruth E. Shoemaker. As you can see, a few people know Ruth Shoemaker. She's being hooded by Mary Capella, and her project is entitled Promoting Sleep Routines and Rituals in Hospitalized Children. Kathleen Fisher, who will be hooded by Susan Corbridge, and her project is entitled Simulation-Based Interprofessional Education to Enhance Communication. Eleanor M. Russell. She will be hooded by Dr. Kathy Ryan, and her project is entitled Identifying Elderly at Risk of Developing Renal Failure Upon Admission to an Extended Care Facility. Okay. Bansuri Patel. She'll be hooded by Dr. Eileen Hacker, and her project is entitled Oncology Provider Pain Training for Better Pain Control. Okay, so I'm going to sort of punt with this. I'd like to introduce Monica Lee, who's being hooded by Krista Jones, and her project is entitled A Great Evidence-Based Practice Project to make sure that she could graduate with her Doctor of Nursing Practice degree.
On behalf of the faculty, congratulations to our new Doctor of Nursing Practice graduates. We now acknowledge our graduate students earning advanced degrees at the master's level. Every year, the college honors students from each department for their superior performance and achievement. Please join me and the head of each department in congratulating the recipients as they cross the stage. Presented by Dr. Marion Piano on behalf of the Department of Biobehavioral Health Science, Jane Simmons and Andrew Richardson. We're going to do the honors.
I'll stay here.
Presented by Dr. Barbara McFarland on behalf of the Department of Women, Children, and Family Health Sciences, Kimberly Marie Duback, Elizabeth Ann Fledge, and Claire Mickelson. Presented by Dr. Lorna Finnegan on behalf of the Department of Health System Sciences. Oba Julu Patrick Onwenkwe. That was not done well. Sorry about that. the name. Was I close enough? It was good. Congratulations to these outstanding nurse leaders. You might want to sit. The Cardew Mullane Award was established by Mary Kelly Mullane, former Dean of the College of Nursing, and recognizes outstanding clinical skills and leadership. The award also serves as a memorial to Emily Cardew, the first Dean of the College of Nursing. This year, I am pleased to present this award to undergraduate students Mohammed Jamal Dean and graduate student Taryn McCoy. I'd be very disappointed if there weren't more than one. Thank you. Set a high bar for you, brother. Candidates for the Master of Science, please stand. The Master of Science in Nursing is designed to prepare nurses at the advanced level of nursing practice. The graduate will have the knowledge and skill to function as an advanced practice nurse in one of several specialty areas. Chancellor Alan Mayers, upon the recommendation of the faculty and by vote of the Senate, I have the honor to present the candidates for the degree of Master of Science.
Upon these recommendations and by the authority of the Board of Trustees, I confer upon each of you the Master of Science degree for which you have been presented and admit you to all the rights and privileges and responsibilities of that degree.
Dr. Kathleen Baldwin, Dr. Susan Corbridge, Dr. Kelly Rosenberger, and Dr. Kathleen Sparbell will recite the names.
Shannon Jeffrey. James Simmons. Andrew Richardson. Kimberly Dubach. Elizabeth Flagg. Kara Michelson. Sandra Hutchison. Claudia Schindler. Christine Schremen. Noelle Norup. Jennifer Lynn Calderala. Robin Affeld. Jennifer Florentino. Shauna Quevedo. Emily Moles. Nicole Bindle. Marilyn Matthew. Jessica Antoni. Michelle Leal. Norma Alvaldera Ruthia. Stephanie Barkley. Kate Stammer. Amanda Foyt. Andrea Shear. Kelly Heyman. Jennifer Diane Yeager. Rosen. Sarah Hormig. Marie Ann Gonzalez. Tangi Moscoso. Carrie Zanoni. Ashley Martin. Tanya Moore. Catherine Endress. And you get Crystal.
Okay. Crystal Wagner. Tisha Bargis. Tigist Yayan Ayello. Sarah Louise Mays. Amanda Brodzik. Natalie Farrar. Leslie Ellen Bassel. Rochelle Lehman. Amelia Besawa Apogee. Juliet Ibanez Panambo. Magajata Boksa. Anna Shkata. Michelle La Wu. Graciela Mechia. Minna John. Melissa Lara Angulo. Michael Meister. Casey Kimler. Mackenzie Likes. Danielle Harris. Elise Marie Mefford. Sarah Preston. Rosemarie Eck. Laura Cordero. Amanda Marie Plack. Jessica Bernardi. Noreen Polte. Deborah Preston. Erin Nicole Beavers. Catherine Trimble. Laura Petrondo. Gregory M. Johnson. Jennifer Helen Benters. Rachel Hoselton.
Christine Horn. Nikki TJ. Marianne Morse. Christina Stevens. Tomas Moore. Michelle Johnson. Nicolette Andrews. Layla Hinshaw. Yorlini Ambrosio. Amanda Ehrman. Laura Jane Collier. Morgan Pick. Jeanette Brogan. Kristen Eckerson. Leslie Martin. Elizabeth Yvonne Tyson. Hayeda Sarabi. Ivilu Irola. Samantha Friedman. Angela Moore. Carly Madden. Sarah Christine Alley. Gina Marie Rosardi. Brooke Rittenberry. Jacqueline Cafode. Yvette Michelle Johnson. Miriam Mustafa. Melissa Salgado Bellin. Melissa Manglalang Salgado. Emily Dennehy Fitzgerald. Grace Gayum Larson.
Anna Bosick. Kayla Albers. Nina Nicholas. Julie Hong. Cassidy Zemke. Erica Weinkatz. Haley Phillinson. Pamela Stefango. Kristen Catherine Steinmetz. Renee Landa. Sarah Bear. Jung. Okay. Ting Ting Rachel Jung. This is the hard one. Oajulu Patrick Onwe Kuwa. Natalie Revels. Sharon Beckman. Libby Wolf. Thanks, Dr. Corbett. Yeah. Sarah Nelson. Kristen Lampy. Katie Carey. Thank you so much, Dr. Coach. Sayori Negagawa. Thank you. Stephanie Hatrea. Thank you. Aaron Robelia. Good to see you. These are all my students. Emily Templeton. Giovanna Antonelli. Amy Thomas Bash. Last name. Congratulations. Francis Walker. Stacy Vusick. Roderick Warren. Molly McClure. Dana Krupp. Megan Boluvia. Joanna Bauer. Sergio Antonio Sosa Jr. Gina Marie Carlson. Ann Nalawakcho. Okay, sorry. Mary Pasquinelli. Cynthia Williams. Jessica Ittner. Elizabeth Sean Evans. Diane Svensson. Botran or Tina Tran. Anu Simon. Bernie Aguilar. Jacqueline Rincon. Abda Basil Eskandar. Rachel Reich Lynn. Jamie Henry. Carolyn Reed. Miriam Correa. Dorothy Claire Tessman. Karen Ida Wennerberg. Marie Rigoni. Jennifer Haume. Jillian Bratagam. Robin Scaife.
Thank you.
Catherine Brown.
Congratulations. What's your specialty? Congratulations. Congratulations. What's your specialty? Nurse delivery. Yay. We got like a cheering section here. Yeah. Congratulations. How you doing? I got Misha. Congratulations. Thank you. One more. Yep. Congratulations. What's your specialty? Wonderful. You're welcome. Congratulations to the students who are receiving a Master of Science degree. Dean Betty Bottoms, Vice Provost for Undergraduate Affairs and Dean of the Honors College, will recognize the students enrolled in the Honors College and those who are receiving university and college honors. Thank you, Dean Weaver. Through a wide range of programs and activities, the Honors College offers support and opportunity to undergraduates who seek extra academic challenge. All students in the Honors College complete an honors activity each term in addition to maintaining a minimum 3.4 GPA. The golden stole that they wear with their cap and gown recognizes these students.
Honors College Faculty Fellows are central to the work of the Honors College. Faculty members apply for appointment as fellows to have the opportunity to work with very talented undergraduates, helping them perform at their highest level of ability. Both as scholars and as teachers, the fellows of the Honors College deserve thanks from the entire UIC community for their successful efforts on behalf of students. I would like now to ask all of the College of Nursing Honors College faculty fellows to please stand and be recognized to their commitment to these students. Thank you very, very, very much on behalf of the students, these families, and me. University Honors recognizes students with scholastic excellence in cumulative grade point average. The three distinctions are cum laude, magna cum laude, and summa cum laude. Students are presented with bronze, silver, and gold accords to represent the three categories of achievement. College Honors recognizes undergraduate students in the top 15% of each program based on their nursing cumulative GPA. Students are presented with an apricot cord to recognize this achievement. Of course, every single student here tonight has achieved great academic achievement, or you would not be here graduating with us today. But I would like to ask now the students who are in the Honors College and those who have received university honors and college honors to all please rise and be recognized for those academic achievements. You may be seated. Congratulations.
At this time, I'd like to introduce Dr. Barbara Simmons, President-elect of the Alpha Lambda chapter of Sigma Theta Tau International. Dr. Simmons will recognize those graduates who are members of Sigma Theta Tau, the International Honor Society for Nurses, and the students who will receive the Sigma Theta Tau awards.
The Honor Society of Nursing, Sigma Theta Tau International, was established in 1922 to recognize and promote leadership and scholarship in nursing practice, education, and research, and to enhance the health of all people. Sigma Theta Tau fosters high professional standards and supports the learning and professional development of our members who strive to improve nursing care worldwide. Membership is by invitation to baccalaureate and graduate nursing students who demonstrate excellence in scholarship, and to nurse leaders exhibiting exceptional achievements in nursing. Members wear the purple honors cord with their academic regalia as a sign of distinction. Will all the faculty and students who are members of Sigma Theta Tau please stand and be recognized? The Alpha Lambda chapter of the Honor Society of Nursing, Sigma Theta Tau, recognizes outstanding graduate and undergraduate nursing students who exemplify the goals of Sigma Theta Tau. The awardees have demonstrated excellence in academic and clinical performance, as well as leadership. This year's undergraduate recipients are Mark Trevor Ryan from Chicago, and Julia Alice Michelson from the Urbana campus. This year's graduate recipients are Eleanor Russell and Soyun Park.
I have the honor at this time to recognize the undergraduate students who earned the highest overall cumulative grade point average from the Chicago campus, Yasmin Hammershaw and Andrew Rickard from the Urbana campus, Amy Selena from the UIC online campus, Jamie Witt, who unfortunately cannot be with us today, was also recognized. Congratulations. Sure that, Andrew? Congratulations. Congratulations. Great teachers are the heart of a great university. The University of Illinois at Chicago annually recognizes and honors its great teachers. Isn't that why we're here? Recipients of the Silver Circle Faculty Award for Teaching Excellence are selected by our students. Christopher Dieters from our Urbana campus will present the award to this year's recipients.
On behalf of the 2014 graduates, I am pleased to present Krista Jones with the Silver Circle Award. Professor Jones, please join me at your podium for the award.
Candidates for the Bachelor of Science in Nursing, please stand. Yeah, gird your... The Bachelor of Science in Nursing prepares nurses for a professional role in nursing with leadership skills to practice across healthcare settings. Chancellor Alamers, upon the recommendation of the faculty and by vote of the Senate, I have the honor to present the candidates for the degree of Bachelor of Science.
Upon these recommendations and by the authority of the Board of Trustees, I confer on each of you the Bachelor of Science in Nursing degree for which you have been presented and admit you to all the rights, privileges, and responsibilities of that degree.
Lee Ann Kitchen, Dr. Barbara Berger, Dr. Mary Dawn Koenig, and Sue Farnwald will recite the names.
Mohammed Jamal Dean. Taryn McCoy.
Thank you.
Thank you. Julia Nicholson. Yasmin Hammershaw. Mark Trevor Ryan. Andrew Riker. Amy Slana. Roshi Shuraya. Scott Palodima.
You did great. Thank you so much.
Sarah Jane Bell. Erica Natira Holmes. Haley Vanderveit. Jessica Berkovich. Kelly Del Valle.
Thank you. You're welcome. Hi.
Elizabeth Russo. Abby Klaus. Lauren Bell. Jonathan Oliver Pakolik.
Close, Leanne.
Dry mouth. Carly Wild. Samantha Plotnick.
Thanks, Leanne.
Kelly White.
Mine's easy.
Jamie Zesko. Haley Taft. Kirsten O'Brien. Abigail Rakolski. Christopher Dieters. Megan Maloney. Jessica Patrisco. Sorry, Patrisco.
Thank you.
Lana Romano.
Thanks, Leanne.
Thank you. Lauren Bergdahl.
Thank you.
Michelle Dupre. Thank you. Cynthia Sao. Megan McCoy. Natalie Marshall. Allison Mangan. Lillian Shepard. Sun Han. Ann Jaley. Good job. Aaron Fernandez. If I don't look, I can say it. If I have it written out, I can't do it. Claire Anastos. Hello there. Meredith Miller. There. Ramey Boyer. Jennifer Weber.
Thank you so much.
Hey, Gagam. Gagam Malconian.
Thank you.
Yeah. I don't want to see you in my office again. Matthew Pablo. All right, Peter. Peter Acapel. Close enough, bud. Sorry.
Close.
David Winters. Victoria Kinney. Thank you. Angelica Porras. Jocelyn Saleta. Good job. Good job. Taylor Franzen. Susan Bray. Victoria Reisinger. Tessa Otto.
Oh, I love you.
Tiffany Michelle Barnes. Daphne Urpello.
Thanks, Leanne.
Ann Tracy. Laura Sokołowski.
Hello.
Brittany O'Brien. Jennifer Eleanor Archel.
Hello, Jennifer.
Jennifer Roundtree.
Thank you. You're welcome. Good job.
Evelyn Chow.
Good job, Evelyn.
Gina Kim.
Good job, Jean. Thank you. Hello.
Allison Moy.
Hello there.
Judy Leong. Cindy Ron.
Good job. Hey, Danny.
Danny Ng.
Thank you, Leanne.
Okay. Thanks.
Patricia Chagares.
Congratulations.
Jennifer DeMasi. Louisa Rickman. Sarah Bramer. Jessica Elefano. Melanie Wazak. Lindsay Siz. Marissa Florkowski. Erin Rohde. Nicole Benedetto. Yulana Kuraluk. Anna Slota. Joanna Wadarchik. Nayeli Liberato. Kelly Huckle Van Kirk. Kelly Flavin. Meryl Messiah. Ivan M. Juba. Zoe Pasanis. Elizabeth Gorbach. Nime Mahmoud. Maritza Villanueva. Chola Patel. Colleen Brennan. Lisa Smith. Fahima Hussein. Lawrence Dorello. Terrence Akebe. Aaron Go. Nayelina Kovdrin. Sajida Patel. Mariana Salas.
Ashley Nacarto. Melissa Stout. Lorna Johnson. Lauren Gay. Anna Gustafson. Yanila Martinez. Clarabelle Matias.
Micah Klopman. Leticia Gomez. Michaela Gozjo. Elizabeth Loper. Yasmin Macabolos. Marianne Reyes. Jasmine Beltran. Christine Utleta. Colin Dent. How are you? Carlos Munoz. Marie Cheslick. Danielle Kelly. Jairo Cortez. Felipe Torres. Ian Gatton. Benjamin Salazar. Chelsea Pfeiffer. Scott Mechanic. William Maranick. Jamalek Sanchez. Christina Sajatin. Lily Ketema. Montina McCord. Natalia Marcikanowski.
Ivy Apotu. Ni Fan. Susan Ruan. Katrazina Robel. Maria Sanchez. Wali Khan. Rabia Ali. Fatir Khan. Tierra Williams. Zainab Williams. Osasu Muen Iborna. Tracy Huang. Marianne Hassan. Taylor Kapesser. Jessica Gajewski. Stanley Banya. Gabrielle Guido. Desislava Stajkova. Marta Mendoza. John Anthony Cesario. Patricia Luevano. Carolina Sikowski. Megan Sturgeon. Ineta Yokubaitis. Anna Rodriguez. Saris Kangu. Danabelle Lingens. Victoria Diana Gandia. Christine Gutierrez. Abigail Rabaka. Floria John. Shotirot Rawisi. Alina Stanakovic. Marius Lysik. Jose Primo del Alcazar. Angeline Brooker. Andrea Cox.
They always say best for last. Congratulations.
Congratulations to the students who are receiving a Bachelor of Science in Nursing degree. BSN graduates, please remain standing to recite the senior class pledge. Sarah Jane Bell, Scott Petalina, and Roshani Suraya will lead the senior class in the pledge, which is adopted from the Florence Nightingale Pledge and the American Nurses Association Code for Nurses. The pledge can be found in the program.
I solemnly pledge myself before my peers and in the presence of this assembly to practice my achieved profession to the best of my abilities. I promise to provide services with respect for human dignity and individuality of all those whom I serve. I will safeguard my clients' rights to privacy, safety, and health care. I promise to participate in nursing activities that will contribute to the ongoing process of professional knowledge. I will endeavor to aid all of the other members of the healthcare team to promote holistic care to all of the clients I serve.
On behalf of the faculty of the College of Nursing, we congratulate each and every one of you. This year we have remarks from an undergraduate and a graduate student. Please join me in welcoming So-Hyun Park from the PhD program to the stage.
Good afternoon. I'm honored to be here to talk about my time in the UIC College of Nursing during the last 4 years. I want to share with you my challenges, how UIC helped me overcome them, and how I have grown through these experiences. The first challenge was the gap between my expectations and my actual experiences. I am originally from Korea, and I was really excited to start my new life in Chicago. I heard a lot about the beauty of Chicago, including Lake Michigan, skyscrapers, and deep dish pizza. However, life in Chicago was a little bit different compared to my expectations. For example, I realized that Chicago has only 2 seasons, winter and construction. I had to see flowers covered with snow in April. There was no time to enjoy downtown because of my busy schedule. And I gained over 10 pounds thanks to fast food and deep dish pizza. The second challenge was living alone as an international student in the US. I had to do my own self-care without the resources and supports that I would have in Korea. Fortunately, UIC values students' diversity, so UIC provides a variety of programs for international students. I utilize those programs such as conversation partners, advice from academic center, and joining the writing group at the College of Nursing. I deeply want to thank the writing group, which is a special kind of support group among international nursing students. The writing group gave me both professional advice and emotional support. Engaging in these activities, I gained confidence and soon became comfortable in my new surroundings. The last challenge was completing the doctoral program. As you know, UIC is well known as a research-oriented school. UIC College of Nursing provided many resources for beginning researchers, such as workshops and conferences. Faculty and staff always encouraged me to participate in those opportunities, such as travel grants and scholarships. These resources and support helped me grow into a nursing researcher and develop my professional network. I want to recognize the support of Dr. Beverly McElmurray, who encouraged me to enter the doctoral program here. Although she has passed away, I am now one of her many students who will continue her legacy. I also want to thank Dr. Kathy Noor and Dr. Misa Kim, who made it possible to complete this long journey. In conclusion, although I had some challenges during my doctoral program, I overcame them, and now I come to the finish line today. Without support and encouragement from the UIC College of Nursing, this would never have been achieved. I want to encourage current students to seek these wonderful opportunities that help you to achieve your goals. Thank you, and congratulations to the class of 2014.
Thank you, Dr. Park. Please welcome Mark Trevor Ryan, an undergraduate from our Chicago campus.
All right, guys. It's an honor to be chosen to speak to you guys today, so I'm really happy to be here. I'm going to try to make this quick because I am pretty much the last thing. That's right. The last person selected to talk, inspire, and teach you at your nursing education was me. So let's do this. Woo! So I want to begin with some congratulations and thanks. First off, to the graduates, we've all worked incredibly hard to get here today. So congratulations on finally making it to your graduation day. Woo! Yeah! Next, I sincerely want to thank all the family and friends. Your ongoing support, love, kindness has helped every single one of us get to where we are today. So thank you, family and friends, for everything. Woo! You guys are awesome. We really couldn't do without you. And finally, I want to thank faculty and staff and all the professors. Your ongoing support. So just thank you for your ongoing support, patience, and kindness. We really couldn't do it without you guys. It's all right. Yeah, things happen in nursing. Don't worry, thanks to professors. Thanks to professors, I'm always prepared with a saline flush, so thank you, professors! Woo! All right, now for the inspiration. Inspiration is going to begin right about now. We are the future. The world is our oyster. Yes, we can. When one chapter ends, another one begins. Carpe diem, Wingardium Leviosa. Life is a wandering path. Go forth and conquer. Dream big. Follow those dreams, and we can repay those loans. Woo! That's right. That's what I call a high CGI, aka it as concentration of graduation inspiration. It's a little too concentrated, so I have a little more time left. So I'll talk about me. I'm from California. Normally in a two-way conversation, this is where people are polite and they'll ask, oh, why'd you choose Chicago? Or why'd you choose here? Or if they're, really bold, they just straight up start laughing at me. And like to remind me that this winter Chicago got colder than Antarctica and the surface of Mars, which is a very cold planet. As well as their tears of hysteria are freezing on their frostbitten faces, I usually like to explain of why I chose to come here to Chicago. I believe adventure and growth lie outside of our comfort zone. Previous to coming to Chicago and going to nursing school here, my own comfort zone was 50 degrees above zero. It's okay, I came here, I got a really big jacket, I got some really big books, and I got a lot of really big coffees, and I made it through. Now, I'm sure all of us had an experience that forced us outside of our comfort zone at one point in time or another during our nursing career. Just go ahead and visualize that. Ugh. But you made it through it. Just remember that, you made it through it. And as we all move forward with our lives, I'm sure we're all going to be forced to step outside of our comfort zone one more time, into jobs that may not be our first choice, locations that are less than perfect. But these are simply the first steps. They may be difficult, intimidating, covered in an assortment of fluids, but they're merely those first steps. And I'm sure we're going to get through these challenges just like we did nursing school. And maybe with these challenges, we'll even make some new friends. We'll have some good stories, get some jokes that it takes a nurse to truly appreciate. And to conclude, trying to be quick, I'm just going to leave you with a few words. It's a quote. I'm not going to be referencing an APA format because I already got my diploma. It's right back there. Don't got to. But these few words, I'm pretty sure that Florence Nightingale said these at least once in her life. We got this. And once again, congratulations, class of 2014. Woo!
Thank you, Mr. Inspiration comes in many forms. Congratulations to our 60th class of new graduates and to you, family and friends who have helped to bring the dreams and hopes of these graduates to fulfillment. Graduates, please stand. You may now move your tassels from the right to the left. Congratulations. And we hope you will all join us at the reception in the tent. Please turn east towards the lake when you exit the pavilion, and the tent is located on the other side of the parking structure. Please follow the signs once you leave the pavilion and do not stop on the walkway to the tent to keep people moving. We ask that you remain seated until all participants in academic dress have completed the recessional. And we thank you ever so much for joining us today in this fabulous celebration. Thank you.